Joining me today is Linda Sorrell, Chief Executive at Melbourne Health. She'll be speaking at IR's National Hospital Procurement Conference, which takes place on the 25th of July 2011 in Melbourne. Hello Linda, thanks for joining me today.
Hi, how are you?
First of all, what do you believe to be some of the key issues facing the issue of procurement in Australia's hospitals?
I think there's an issue with regards to the Australian dollar value, in so much as that often companies, will put the price up because the dollar is different and the value of the dollar is different, but we don't often see the flow on when the value of the dollar changes. So I think that's one issue for us as well. Also, the other one is in relation to our funding methodology within Australia, and probably might be particular to Victoria. It may be the same in other states as well, but often we don't get the correct CPI adjustment in our revenue to offset the costs of increasing prices that are around consumables and prosthetics and various things like that. So for us, our revenue doesn't always match our expenditure, and we struggle to try and create more revenue in different ways. And I think probably the third thing is around data availability within the health sector, particularly within the public health sector. The private health sector may be better at it, but I think we still have an issue around actually understanding what drives our costs in a lot of instances, particularly when you want to get down into detail and actually determine how much you're paying for individual, for example, gloves or pieces of consumable dressings and various things like that. We can't actually drill down in a lot of detail within the public sector as much as you probably can in the private sector.
Can you run me through Melbourne Health's supply strategy and its aim in creating an independent shared supply service?
Well, Melbourne Health runs a shared supplied service. It's been in operation for about 11 years now. It is a leftover from the old network days, so Northwestern Healthcare Network, which was probably many years ago under a different government. And in the intervening years, they broke down that network into various health services. Under that arrangement, Melbourne Health maintained the shared service, so to speak, whereas we actually run the supply service, the logistics service, for a number of other health services. For example, we currently have, around about 18 hospitals and 12 nursing homes that we actually purchase for and deliver to, and we also have independent health services, and then we have other health services that are managed under commercial agreements and some that are managed under a shared service model. So we've been trying to do a lot of work around that particular area, and we have a warehouse out at Tullamarine, which is a new warehouse that's only been in operation for about 2 years now, and we've specifically chosen that particular area because we can actually do just-in-time delivery.
And what have been some of the key project achievements so far?
We've done a lot of work around trying to set up our distribution centre so that we can actually use it in an efficient manner. So we've tried to create bulk storage so you can get better buying efficiencies, where there can be a single point of delivery for suppliers, which means you can make savings out of that. There are also some centralised buying and customer services that are located on site as well. We've also been doing quite a lot of other key projects around trying to improve the efficiency using Lean Six Sigma methodology. One of the ones that we did was that we actually looked at all of the impress in all of the areas within the hospital, so in the ward areas, in the intensive care unit, in the emergency department. And we reviewed the way that we're actually using those consumables and how we were actually delivering and how much we were delivering. And what came out of that particular project, and that's only one of them, was that there were inventory savings, there were labour savings, we had better ongoing control, we had better storage, and as I said, we actually made savings in the process. So I think the first 10 departments resulted in about $40,000 in saving. And also we've done other projects as well. We've done some work around accounts payable. Accounts payable wasn't really meeting the customer's needs because there were delays in payments, there were quite a lot of lost invoices, inaccurate processing of invoices, and the accounts payable area couldn't respond to the numbers of calls that were coming in. So what we did was we re-engineered the processes from approval by the department to payment, and we now have streamlined the handling of queries. It's now electronic. And we've done a lot more work around reconciliation of supplier statements and certainly making sure that we've educated everybody about the correct processes. So what we've seen is that we've seen certainly some improvements in that particular area in terms of customer satisfaction. And that's only just 2 projects that I've spoken about. There's been another one where we actually looked at how we managed our taxis and couriers, and that was a significant issue for us because we spent nearly $2 million in 2007-08 on these particular items. And we knew that we could, if we actually improved our coordination, we would actually make a lot of savings in that area as well. So we've reviewed that, and we've reviewed the service needs. We removed duplicate and unnecessary trips. There was a 36% reduction. We merged the internal couriers into one team. We improved the occupational health and safety and the work practices for the people that were driving the vehicles. So overall, I think we've made a lot of improvements in that particular area.
What are the future plans for the project, and how do you believe other states could benefit from adopting such a scheme?
Well, we've done a lot of work around the actual warehouse and how we're actually managing things. And one of the issues, when you asked me about what do you believe are the key issues facing procurement in Australian hospitals, and my answer to you was around about data and things like that. We've actually now got down to where we can actually drill down into the actual detail of the data, so that we can actually compare the types of gloves that are purchased by each ward, and we can compare the cost of individual dressings across different ward areas, and we can also look at how many of those items are being purchased. So we're actually embarking upon a new project now, which is around medical expense management project, which is about the category codes, and trying to make sure that we're not buying expensive items when a cheaper product will actually do the same job. We're going to start on that journey now. We've just started it, and we're going to be using the Lean Six Sigma framework to be able to do that. The other part of the project that we're going to tackle is around actual buying practices within Melbourne Health, and about whether or not we can rationalise the numbers of suppliers, whether we can rationalise the numbers of items available, and whether or not we can actually make some savings out of that. It's quite a complex project because we do manage services for other health services, and that the fact that we're also trying to do that within Melbourne Health as well. So it is going to be quite a complex project. It's going to take us a fair bit of time, but we honestly believe that we can probably deliver several $1 million in savings as a result of that. I'm sure that that could go across into other states as well if they can actually drill down to some of the data and actually look at the buying and the ordering processes within their organisations.
Linda, you're speaking at IAR's National Hospital Procurement Conference on the 25th of July 2011 in Melbourne. What are some of the aspects you'll be covering in your presentation, and what would you like delegates to gain from attending?
Well, I'm going to cover some of the things that I've talked about in this particular interview, particularly around. I'll give you a little bit of background about how it's run and why it's run this way, and some of the achievements that we've made through some of those improvement projects. So I've covered some of those briefly today, and hopefully I'll be able to give a little bit more detail when I'm speaking at the conference, and also whether or not there's any opportunities. And I hope that I'm going to be able to give you some information that the people that are attending this conference may be able to take away with them and think about the way that they're doing their business within their own organisation, and actually improve the customer satisfaction. And customers can be many people in this instance, can be suppliers or the people that are actually doing the ordering in the hospitals and the use of the consumables. And hopefully you might be able to take something away and save some money as well.
Linda Sorrell, many thanks for your time today. We look forward to your presentation at the event in July.
Thank you very much.